I started bringing atrial fibrillation treatment concomitantly into my cardiac cases, particularly with the volume of mitral valve surgery that I do years ago when the initial radiofrequency ablation devices became available. It was apparent that we could make an impact in these patients who might have had short-term atrial fibrillation, and since we're operating on mitral valve patients earlier, oftentimes before the left atrium gets very enlarged or blown out, if you will, the success rate is much better if we see those patients earlier. 95% of atrial fibrillation in those patients comes from the interface between the pulmonary veins and the atrium. We can exclude or do pulmonary vein isolation, and those patients will do much better as well as resolve their atrial fibrillation. Oftentimes, if you talk to the patient also preoperatively, and they do have significant mitral insufficiency, most of the time obviously from a degenerative valve, so we need to do something mechanical or do a true mitral valve repair. They might have had some dizzy feelings or some palpitations, and even though they may be in sinus rhythm, they might have had some episodic atrial fibrillation, which can be potentially stopped or inhibited by doing a concomitant maze at that point. Usually we see our patients 2 to 3 weeks after surgery or post-operatively for their visit. Knowing that they can have the potential of getting off chronic or lifelong anticoagulation is huge for the patient, because it's really tough. You know, you got to watch your diet and your activity levels. If you get any type of bumps or bruises, they become a more significant event. If you can do something so simple as do pulmonary vein isolation and maybe some other lesions and exclude the left atrium, which doesn't really add a lot to the procedure overall time-wise, as well as certainly not risk. And if you can get someone that remains in a sinus rhythm, that's a huge thing for them, not only from a patient comfort standpoint, but really from a physiologic and medical standpoint and longevity standpoint. Patients obviously do much better remaining in sinus rhythm.